I welcome you and hold the session over to you.
Assalamu alaikum everyone, and thank you for the lovely introduction, Dr. Nimra. If you could please confirm that I'm audible or not.
You are audible and you are visible.
Thank you. And can you please confirm if my slides are visible?
Yes, your screen is visible.
All right, thank you. So hi everyone once again, and thank you all for tuning in. So the topic of today's workshop isn't exactly directly related to the process of research, but it is equally, if not more important, because why do you do research? You do research so you can publish it and then you can present it to peers and to people who work in the same domain as you, right? And people are going to want to see your work if you are presentable in real life, if you look professional enough. I'm not going to want to talk to someone who doesn't look professional in a professional setting, right? And because social media is said to be a direct extension of your actual presence in real life, it is very important for you to make sure that you control how people perceive you online and that you curate your presence yourself. And that is why it is very important for you to start early on and to use that and to start using social media in a professional capacity, right? So that is one of the reasons why you should get involved and make professional accounts online. Secondly, it also allows you to, as we said before, it allows you to share your work, but also allows you to look at the work of other people as well and to connect with them and to network with them. And it also allows you to, the beauty of social media is that it allows you to connect with people globally, right? And in essence, it allows you to also look at clinical perspectives of people working in different countries. So for example, you might know that in the UK, the GMC and the NHS releases guidelines every now and then. They keep changing, right? And it might be very beneficial for you as a healthcare professional to be able to look at those guidelines and to maybe replicate that in your own setting as well. In Pakistan, where we don't have a similar set of guidelines, right? And also, most importantly, it allows you to network with people that you might meet in the future. So for example, I'll tell you a story of my own. So when I met Dr. Ahmad for the first time, he did not know me at all. He did not know who I was. I introduced myself. He asked where I was from. He asked about my parents and when they worked. And based on that information alone, mind you, he didn't even see my face. I was wearing a mask. But based on that information alone, he was able to connect me to a tweet of mine that he had seen earlier. There was a tweet of mine that went viral because I had a publication before I even entered med school, right? And that worked as my wow factor when I was meeting a faculty member at my university, right? So that begins to show you how important it is to have a positive presence online, especially on websites like Twitter that that the medical world uses so frequently now. And so this is a screenshot from the official website of the American Medical Association that talks about the reasons why you should get involved in social media and especially on Twitter. So you can go through that, and it basically explains why you should be doing this early on during med school. And we'll talk more about that later on. But first of all, we're going to talk about why, and we're going to talk about how you should be using Twitter. So first of all, you should ensure that the name that you present on Twitter is your real and proper name. And same goes for your Twitter handle or your username as well. And you should ensure that you should also insert a title if you have one. So the chief of surgery at the University of Chicago has entered MD. Of course, you won't have an MD right now, but if you have a title, you should add that. And then as you can see that his username is also reflects his real actual name, right? And other than that, you should also have a clear, presentable, appropriate profile picture. Now, why is that important? You don't need to have a headshot of you, but you should have a picture that allows people who meet you later on to be able to recognize you. So for example, if I see this picture of Jeff Matthews, and if I meet him later on, like a week later, I will most probably be able to recognize him, right? So that, and that begins to show you the importance of having a clear picture that is recognizable. I've seen pictures of people. It is important for you to have a picture of yourself, because I've seen people who have pictures of, random stuff like, I don't know, like BTS or something. And if they DM me, I will never ever respond to them, because that seems like a fan account to me. That doesn't really seem like a proper account or of an actual individual. So I will most probably not respond or network with that person, right? So that is why it's important for you to present yourself professionally and to have a picture of yourself on Twitter, right? Moving on, so your Twitter bio. Your Twitter bio also should be very professional. It is said to be kind of like a modern virtual business card. So it should include the things that you do, something about yourself. It's a summary of yourself in 160 characters. So it should include what you do, where you work, what your interests are. And if you add the institution that you work in, or an organization, a professional organization that you're affiliated with, for example, if you add that you're an intern at CHSR, then you should probably also add that your tweets are your own, and they do not reflect the professional opinion of the organization that you're working for, right? And if you're a healthcare professional, and actually if you're a medical student as well, you should probably also add that your tweets are not equal to medical advice. It is highly unethical and actually should be illegal to give medical advice like that online. So make sure that you add that as well. And so in summary, a good bio basically includes your position, if you have one. So for example, if you are a program director for residency, you add that. Your titles, if you have any. So for example, you have an MD, you add that. And your interests in medicine and outside of medicine, right? So now that I want you all to curate your own bios right now. So I'll do that with you guys. So for example, make your own bios and add them in the chat box. So for example, I would probably write my position. I don't have a position, so I would probably write MS2. That means medical student, a second year medical student. And you can add this as a divider. Titles, I don't have any titles, but I could probably add that I am an intern at CHSR-FMH. And what are my interests? So I am interested in photography, for example. I am interested in reproductive health, stuff like that, stuff that is related to medicine and also outside of medicine, right? And then also, people usually also, if you're applying for the match, people also add there an IMG, so I could add that. And if I'm applying right now, I could probably add match 2023, something like that. As you can see that these people is these examples that I've added, they've added the images, the emojis that represent their own country as well. So you can do that as well. And you can add more hashtags, like, for example, I would probably add women in medicine or something like that, something that reflects me, my interests and things that I am passionate about, right? And why is that important? Because, for example, you've added that you're an IMG, right? Now that will allow you to, that will allow your juniors to connect with you who want advice on the match process. And it would also, because you've added stuff like reproductive health, that will also allow you to connect with people who are working in that domain, and that will work in your own favor, right? So I want you guys to make your own bios right now and add them in the chat box, and you'll see why we're doing that in a second. But moving on, so now we're done with the name, the username, and the bio. Your profile is complete and looks professional. Now, what are you going to do on Twitter? Coming to the things that you can tweet, you can basically, if you're attending a conference, for example, you could tweet about the presentations that you're seeing. You could take pictures of poster presentations if obviously you're allowed to do so. You could share your own work. You could share your publications. You could comment on other publications. And that brings us to retweeting. So there's two ways that you can retweet on Twitter. You can either retweet the tweet as it is, or you can retweet with a comment. So you can retweet with a comment and comment on an article that you've seen, on interesting cases that people put up on Twitter. And you can do all of those things yourself as well to engage with peers globally, right? And something that's very important is to share your achievements and your accomplishments on Twitter. Now, why is that important? Because literally everything that you put out on Twitter people are going to see it. There are important people on Twitter who are going to see it. I've seen people like program directors, I've seen like deans of medical schools who are on Twitter personally, and they're going through tweets of people. So for example, I had this tweet from 2020 about a publication, and a dean of a well-renowned medical school went through my Twitter during 2022. Now he found that tweet from 2020 and retweeted it and commented on it, right? So that begins to show you how important it is and how much time people spend on Twitter. Even though it might seem like, oh, like that person is probably so busy, why would they be spending time on social media? But that's wrong. Everything that you're doing yourself, if you're stalking people on Twitter, the deans of medical schools are also stalking people on Twitter, right? Okay. And also, whenever you like a tweet, it is going to show up in the feeds of people who follow you. So for example, it's going to show with the tagline that Eemaan Ahmad liked this, and then the tweet is going to be in their feed. So you should be very careful about the kinds of things you're liking on Twitter. And on your profile, there's also a tab that shows the things you've liked. So just make sure that you're liking things that aren't inappropriate. Obviously, you can like things that are outside of medicine. For example, if you're a football fan, you can like tweets that are about football, but just make sure that there's nothing inappropriate and nothing that someone would judge you on, right? Judge you negatively on. Okay? So recently we had this journal club about different ethnicities, the comparison between different ethnicities and their different BMI cutoff values. So imagine that you're at a conference, right? And you see this poster presentation. What would you tweet, and would you attach a picture or not? I want everyone to respond in the chat box. So if I was in this situation, I would take a picture of something visual. So for example, probably a graph or something, obviously if I'm allowed to do so. And I would probably make a comment like, oh, this study has been conducted in the UK, and we should probably replicate this in Pakistan to see if we find the same data about South Asians in their country of origin, right? So that kind of strikes a conversation with people in the same domain, with professionals who might comment on that and give you new ideas about, and you can give you new ideas about this topic, and you can even then take those ideas and conduct that research yourself as well. So that begins to show you how important it is to do things like that, right? And obviously you have to be very cautious about everything that you do. And you can also be humorous, but you can make funny tweets, but again, don't cross any boundaries. And you can also express your own political and religious opinions as well. But people, again, there are a lot of people who are reading your tweets, and people will know what side you're leaning on, what side you're inclined towards. So just make sure that you're very careful about whatever you say on Twitter. And then who to follow, obviously your colleagues, your seniors, your mentors, and that's important so that you can support them in their tweets as well. Accounts that align with your mission. So for example, if you're a hepatologist, you would follow journals that talk, you would follow journals, hepatology journals, as well as liver society, so that you can look at tweets and you can connect with people who work in the same domain, in the same field as you, right? And then a summary of the things that you should not be doing on Twitter. So you should not unlike or delete a tweet. There's literally no point unliking a tweet, because like once you've liked it, the tweeter has received a notification that you like the tweet, right? So there's literally no point in unliking it. And deleting a tweet, why is that? There's no point in deleting a tweet, because if people have replied to your tweet, there's going to be, even if you delete it, people will know that you tweeted something. If it was something controversial, like literally there's no point in deleting it, right? So just make sure that when you're putting out things on Twitter, just be careful, and just be very, very careful in the first place. And then post things that do not represent you. Don't do that, because, for example, like you can empathize with people. So for example, if I am Pakistani, and this is a huge discussion in the US that, about underrepresented minorities in medicine, right? So I could empathize with them. I could make a tweet or two, but it doesn't make sense for me to keep talking about that issue and to make it, like a central point of my personality on Twitter. It doesn't really make sense, right? So the wise thing for you to do is instead talk about problems in your own country and problems that, like Pakistanis face in the US, for example, Pakistanis face in Pakistan, for example. Like that makes more sense. As a woman, I could talk about problems problems that women face in healthcare as patients, as professionals, right? That makes more sense. And then don't tag people in posts that are not related to that field. Actually, this is very useful. It is very useful to tag people. So if you get accepted to a university, for example, and you're sharing that you got in, right? You can tag, and actually you should tag the account of the university and the dean and maybe some professors. Like that makes sense because that would also allow you to connect with them, and if they respond, it will make you famous basically. But it doesn't make sense if you got into university A and you're tagging the dean of university B. Like that doesn't make sense, and that also looks inappropriate. If I were to see a tweet like that, I would judge you so hard. Like please don't do that. Use fake names. Again, doesn't make sense. You are Eemaan Ahmad. Why would you write I love BTS on a professional account? Does not make sense. If you want to do something like that, if you want to have a fan account, just make sure that it's private. And like you're using this account to connect with real life people. So just make sure that it's an extension of you in real life. It's not an extension, it's not, like another personality of its own. And then do not use emojis all the time. So if you're responding to a tweet of a director, if you're responding to a tweet of a program director, don't add hearts or like hard-eyed emojis in it, because that again does not look very appropriate. And again, don't DM people for help without knowing them. So I could, for example, DM Dr. Ahmad even if he didn't know me, but I would probably add that, oh, I study at your university and I'm an intern at CHSR. So that's okay. And again, sometimes people don't respond, but doing something like that is appropriate. But DMing someone that you don't know at all, or you are not affiliated with them or their organization in any way, that is again a bit inappropriate, and it is advised not to do that on Twitter. Now, things that you should be doing on Twitter. So you should retweet to support your mentors and peers. So if your mentors and peers are sharing their publications, their work, you should be retweeting that. You should ideally be retweeting that with comments because they're going to be doing the same for you. And when they do the same for you, that's going to help you network with important people in your field, right? Retweet to represent your identity or things that you care about. So as discussed earlier, I could probably tweet about something like women in healthcare, problems that affect women. So I should be doing that, right? Like posts, again, like appropriate posts, posts that are, it's okay to like posts outside of medicine as well. And sometimes just lurking is fine. It's okay to not be that active on Twitter. Like it's okay to not do anything at all for a month or two. And yeah, that's perfectly fine. Don't force yourself to, don't force yourself to be someone that you're not. It's perfectly fine. Okay, so now moving on to Instagram. Now, if you were to make, I think all of us have private accounts on Instagram, but if you were to make a public account or a blog, what would that be on? So I'll give my own example. Actually, I do have a public account. It's at Eemaan Shoots, go follow. But so basically, that's a photography account, right? So I would probably make a photography account. But that is something that is outside of medicine. So if your answer was something that wasn't related to medicine, just know that people will know you for it. So if I were to go for an interview, if someone searched Eemaan Ahmad on the internet, they will probably find my photography page, right? So if you're making a public account, just make sure that the theme of that account is something that you want people to know, and it isn't something that you would want to hide, right? And make sure that the content that you post is appropriate. Now, because I have a photography account, it's very unlikely for me to post anything inappropriate. But yeah, I hope that makes sense. And you can keep your Instagram private. So if you're using it if you are using it in a professional capacity, you have to keep it public. It is highly recommended to do so. But you can also choose to keep it private. So like all of us have private Instagram accounts as well, right? But that is in contrast to Twitter, where you are highly recommended to keep it public because yeah, We already talked about that. So if you're keeping it public, the same rules apply more or less that we've already discussed. So your name should be your proper actual name. Your Instagram handle or your username should be your actual name. But on Instagram, it is kind of acceptable to use something else as a username. So, for example, I've included these examples. This is Dr. Shiri Sayed. She works at Mount Sinai in New York. So she's written her real name, Dr. Shiri Sayed, MD, NYC blogger, in the name section, right? But in her username, she's included Halal Girl New York. So it is acceptable on Instagram to use something that represents the theme of your blog, the theme of your public Instagram account as your username. That's perfectly fine. And so you can also turn your Instagram account into a professional account, and then you can add your occupation as well. So as Dr. Shiri Sayed has done here, she says that she's a blogger. And Imra Iqbal Ahmed, she's a medical student. She says that this is a personal blog. So you can do that as well. And then again, the anatomy of a good bio, you should have your position, so where you work, if it is a professional public account, where you work, your titles if you have any. So Dr. Shri Sayed has added that she has an MD, so that's her title. Her position is that she's a medicine resident physician and YouTuber, and your interests as well. So and also you should also probably add DMs are not equal to medical advice. Again, it is highly unethical, and should be illegal to give any sort of medical advice in DMs. Like that should also only be done in a professional manner. And again, as we talked, that you can also choose to keep it private. So this is an account of a founder of a startup, and he has chosen to keep it private. So that's perfectly fine as well. And who to follow, again, same rules as Twitter. If it's a personal account, you can follow your friends, etc. But if it's a public account, you should follow your colleagues, your mentors, your seniors, accounts of institutions, professional organizations. If you have a blog, you should follow similar blogs. So again, because it helps you network with people who work in your field, who work in your domain, right? Now, how to use Facebook? Facebook is usually very personal. People usually don't use Facebook to network. So in that case, you should, again, you should have an appropriate profile picture, because you're probably going to have your full name on Facebook, so someone can search that up and can look at your picture. So you want that to be appropriate, and you want that to, it's not really necessary to have a recognizable picture on Facebook if you want to keep it private. So that's fine. It's not really an issue. But your posts should ideally be on friends only. So there's different privacy settings for each Facebook post, right? So it should ideally be on friends only. And you can also change the privacy settings of your previous posts as well by going to your settings. There's an option to do that. And but if you are using Facebook for networking, so for example, there are Facebook groups that help people to do that. So there's the Facebook group of APNA YPC. So APNA is the Association of Physicians of Pakistani Descent in North America. YPC stands for Young Physicians Committee. So that's a committee in APNA. There's a Facebook group for that. And people, medical students and young graduates basically use that group to network with physicians. And so if you're doing that, just make sure you have a clear, in that case, you should have a recognizable profile picture ideally. And also, like again, the thing that we talked about earlier, that you should not be DMing people unless you know them. So I've actually seen comments in this Facebook group that, people are like, oh, can you check your DMs? And then they respond, okay, no, please don't DM us. Like, let's just keep it in the comments. So again, like that begins to show you that people actually do mind if you DM them and if they don't know you at all, right? So just make sure that your behavior is appropriate. Now, LinkedIn. LinkedIn is literally basically your virtual resume. You have your education in it, you have your work experience, you have any awards or honors that you have. It is literally used for, it is great for networking, and it is literally used by everyone. So for example, if I meet someone at a conference, if I know their name, I'm probably going to search them up and be like, oh, I'm going to look through their LinkedIn profile. So that begins to show you how important it is to have an up-to-date LinkedIn profile. And LinkedIn is actually very easy to use because it's sort of like a form because they have those sections ready for you. So your education, you just have to uh, put in where you studied and experience. They have all of those titles. You just have to fill them up, right? So I'm going to show you an example of a good LinkedIn account. Just a second. Okay, so this is the LinkedIn account of Dr. Osama Sayed. He is a dermatologist in New York. So as you can see, this is basically, he has a short introduction of himself, his education, his work experience, his education again, his skill set, and then there are people who can endorse this, and then his honors and awards. So if you go through a profile like this, like his profile looks pretty loaded, right? So if an employer is going through this, like if I was an employer and if Osama Sayed came to interview, if I was his interviewer, I would probably give him a job, right? And then we're also going to look at the profile of Dr. Sayed Atar Anam. He is the chair of surgery at the Khan University. And so his education section shows you that he is an alumnus of Cadet College Hassan Abdal. Now, why is it important to be on LinkedIn? I know someone in first year at AKU who has connected with Dr. Atar Anam solely based on the fact that he is also an Abdalian, right? And he is literally the chair of surgery, and now he is now that student is in the good books of the chair of surgery at his university. Residents literally spend their entire residency trying to connect with the chair of their department and to be in their good books. So that, and this student has done that in first year solely based on the fact that he is an alumnus of CCH Hassan Abdal. So that begins to show you how important, just how important it is to be on LinkedIn and to have a good presence, a professional presence on LinkedIn, right? So returning to the presentation. Okay, so we've talked about LinkedIn. You can go through these profiles at yourself as well and look in detail how they've presented their education, their skills, and also LinkedIn also allows you to connect with people in your own field, in your own domain as well. So that's also very helpful if you connect with someone and if someone else sees your profile, you know, like you get the point, right? People are going to see your profile, and that's very important when you're in the job market. You can see the profiles of Samas. We've already seen the profiles of Samas and Atar, and now you can also see Ali Abdal's profile. That was also very good. And ResearchGate. Now, ResearchGate is basically, in essence, as the name suggests, it is a website to showcase your research work, to connect with people, to read their publications, and to sort of connect with people who might want to work with you if you have the same research interests, right? So basically to connect with people. Again, it's a networking site. So on ResearchGate, you should ideally add a professional profile picture. Now, this is from their official website. ResearchGate states that that profiles that have a picture are usually on average receive 150% more views. So it's important to add a profile picture on ResearchGate to add your skills and expertise, and to also add your institution and department so you can connect with people who work at your university or in your department. So again, we're also going to see an example of a good ResearchGate profile. Just a second. So this is the profile of Dr. Zain Chaudhary. He works in the NHS. As you can see, here's a small introduction of him. He has a professional, appropriate profile picture that is recognizable. So that's very good. It gives you his skills and expertise as well. So he does systematic reviews. He is interested in immunology. So if, for example, you were looking for an opportunity to work in immunology, you could probably connect with him. And then it gives you a brief overview of his publications. And it also allows you to click on one of those and to see the abstract, to read through the abstract. And if the full text is available, you can download that as well. And what the beauty of ResearchGate is that if the full text is not available, so for example, for this article, the full text is not available for free. You can try requesting the full text, and you can, basically get in touch with the author and see if they send you the full text. And usually authors do that. So you can do that as well. And there's also this tab of network. So it shows you people that Zain Chaudhary has cited, the work of the people that Zain Chaudhary has cited, and also also people who have cited his work. So, for example, if there's someone very famous or very well renowned, and he or she has cited the work of Zain Chaudhary, he's probably going to want to show that to the world, right? So that's also helpful to have in ResearchGate, right? So again, returning to the presentation. So we've talked about ResearchGate, and that is it for now for today. I think that all of you should, first of all, declutter your Twitter. So what I did was I actually made a new account in 2020. Like, you can do that if you want to, but so go and declutter your Twitter, put up a good profile picture, make it professional. Maybe you can use the bios that we've curated today, and then choose whether you're going to keep your Instagram account private or public. Ideally, keep your Facebook posts private, and go and sign up for LinkedIn and start creating your profile today. Because if you keep delaying it, because you should ideally have it right now, right, for networking purposes. But if you're going to delay it, then there's going to be a lot of stuff piled up that you're going to have to add. You're going to remember that, oh, I attended this conference, I did this, I did that. It's going to take a lot of time. So ideally, you should start making your LinkedIn profile right now. And you should also sign up for ResearchGate. Again, add a professional picture and connect with researchers, and individuals that work in fields that interest you, so that you can, maybe find some opportunities to do meaningful research. And that is it from my side. If there are any questions or queries, please do leave them in the chat box. But for now, that is it. Thank you so much for listening, and thank you everyone for your patience.
Eemaan, before we proceed with the questions from the attendees, I have a question, and that is that if, like, as you mentioned quite a few times, that it is not very appropriate to DM people for networking and all, what should be the appropriate way to connect with those people?
So usually, if you are affiliated with an organization that they're working for, so as I mentioned, Dr. Ahmad, it is appropriate to DM people in that case. But it is more appropriate to maybe send an email that is more professional, in my opinion, and maybe just tweet at them. That is also all right, because it is public, and DMing is something personal and something private. So that might be inappropriate. So you can send them an email, or sometimes people also tweet that you can DM me for this particular purpose. So if someone has said that, then it's perfectly fine in that case to DM them.
All right, thank you, Eemaan.